Lie on your stomach and place your fingers around your greater trochanter, which is the bone on the outside of your hip. Straighten your leg and slowly lift up and assess what happens to that greater trochanter. Compare to both sides and see if one side feels different than the other. If your greater trochanter feels like it stays in the same place, that's a good sign. If it feels like it shifts forward as you lift your leg up, or even like it gets sucked in as you're moving, then that could be a sign that those deep hip muscles are in a shortened, tightened state and they're compressing the top of your femur, the top of your thigh bone, forward. Another test for dynamic stability will be to place your hands on the front side of your hips, and as you lift your legs straight up in the air, see if you feel any increased pressure of your hip into the hand as you raise. This can be a sign that you're not stabilizing well with the low back as your hip moves, or it can also be another sign that those deeper hip muscles are tight in the backside and they're compressing and pushing your hip forward into the hip flexor. Lastly, it's always great to test in standing to see how your body stabilizes under load. If you feel that greater trochanter move forward or you notice your low back arch as you extend your leg, that is a sign that we need to work on increased dynamic stability. If you're standing and marching and you feel one side shift, you feel a hike up, or you feel that greater trochanter get sucked in, then that's another sign that we would want to work on loosening up the tightness in the deep muscles of the hip and pelvic floor and improving the dynamic stability between the front of your hip, the side, back of your hip, as well as your core.